In the shadow of science. Berlin, 1978. Behind thick concrete walls and frosted glass, a patient trembles, not from illness, but from fear. A man in a white coat enters, but he isn't just a doctor. He's an agent. His pen, sharper than a scalpel, cuts through the mind. The diagnosis, betrayal, the prescription, silence. This was Dr. Horst Bacher, the Stasi's psychiatrist. Not a healer, but an architect of psychological breakdown. At the Berlin-Hohenschönhausen prison hospital, medicine was not mercy, it was manipulation. But here's the twist. Just 1,000 kilometers away, in quiet lecture halls of Uppsala and Stockholm, Swedish scholars were shaking hands with their East German counterparts. Under the banner of scientific exchange, psychiatrists, neurologists, and pharmacologists from Sweden and the GDR shared papers research. An ideology. Officially, it was about learning, about collaboration. But what went unspoken was how GDR psychiatry viewed the mind not as a mystery, but as a mechanism. One to be studied, categorized, and if necessary, controlled. Swedish psychiatry, rooted in democratic ideals and humanism, began to subtly absorb this influence. Case reports grew colder, diagnoses grew broader. And the definition of deviant behavior grew. Political. While Swedish doctors never tortured prisoners, the exchange of theories, untested, unchecked, blurred ethical lines. What was once a question of healing became a question of control. Were they watching symptoms? Or shaping obedience? The GDR used psychiatry not to help, but to silence. And through academic diplomacy, some of that clinical detachment seeped westward, quietly, uncritically. Science without ethics is not progress. It's propaganda in disguise. So today, as we honor the victims of places like Hohenschönhausen, let us also look inward. Let us ask, not just what they did in the East, but what we welcomed in the West.